when I made the decision to switch over from being a chief clinical officer to a CEO, I was inspired to lead a sustainable enterprise with a clinician's heart, because that can be done. Because to me, patient safety and patient care always comes first. And when our team believes that that's who we are, then the leadership part becomes organic.
I definitely think the adoption of AI and how to do that within our organizations is what I'm talking to a lot of my colleagues about. How we can do it ethically, how we maintain our compliance, because our industry is a heavily regulated industry, and which is very important, but it also comes with a lot of challenges and things we need to be mindful of. So we're looking at how can we incorporate this technology across our organizations, from the admissions process to the clinical documentation process through the finance department. I mean, it's penetrated everywhere.
Welcome back to Mastermind. I'm your host, Mark Scrivner. Our team took the show on the road to NAATP National 2026 to catch up with the leaders, innovators, and voices driving the behavioral health industry forward. We had so many incredible face-to-face sessions on the floor this year, and today we are bringing you one of those dynamic conversations. Let's take a listen. Welcome back to Mastermind. I'm your host, Mark Scrivner, and as always, I'm joined by my fabulous co-host, Jeff Skillen. Jeff, welcome to the show, man.
Mark, it's great to be here. Great to be here at Amelia Island. It's going to be a great day.
Yeah, well, this episode is going to be a special one because we are coming to you from NAATP National 2026. This is an exciting episode. NAATP is where all the big decisions in behavioral health get made. And today we're joined by two fabulous guests. We have Jamie Vinck. She is the president of the Meadows. She's also the board chair of NAATP this year, and she is the author of Recovery Playbook. So, Jamie, welcome to the show. Great to have you. And Kelly Scaggs. Kelly is the president, CEO of Fellowship Hall, and you're also the chair of NAATP National 2026. So, Kelly, welcome to the show.
Thank you. It's my pleasure to be here.
It's great to have you all excited about this episode. Thank you all for taking time out. We know how busy your schedules are. So, we'll go ahead and just get kicked off.
You know, we're not worthy here to be in your presence this morning. Just kidding. No, super excited to have both of you all on. As you all are approaching this conference, I'd be curious, what are your thoughts as we all get together and this thing's kicking off? I know you're going to be on stage any minute now. So, I mean, Jamie, what are you thinking about as this conference starts?
I love this conference. It's the highlight of my year. And last night was the awards dinner, and we celebrated as a number of things, but we celebrated the lifetime achievement of Pia Melody, who, as someone who works at the Meadows and as a clinician, she has been near and dear to my heart for many years.
Yep.
And her son gave just a heartfelt talk about her work and being a mom and a grandma. And where I'm going with that answer is that the awards dinner has always felt like Christmas Eve to me, and that makes this Christmas morning. And I have that.
We get to open this present for the entire industry. I love it.
That's exactly right. And I feel that way every year that I've been to this conference, and I've been coming here since 2015. So
I really thought that was a special moment last night. It was really, it was moving. And I mean, and a fitting tribute to a legend in our industry.
Absolutely.
100%. Kelly, what about you? What's on your mind?
Well, this morning, in full transparency, what's on my mind is that I have to get up in front of all of these colleagues and amazing people in the industry and welcome them to this conference. And I'm praying that that goes well. But like Jamie, this conference is my favorite one of the year because it's one of the only times I get to see face-to-face some of my colleagues. And we'll communicate throughout the year, being here and getting to have these conversations. And the thing I love about the NAATP conferences is we're always talking about what seems to be top of mind for me as a leader in the field. And so it's great to get in a space with other leaders and be able to talk about it. And this year's conference is really focused on embracing the technology, particularly AI, and that's something as a leader that has been at the forefront of my mind, not just this year, but particularly in this year where things just seem to be moving at a lightning pace. So I cannot wait for the panels and the presentations. I'm very excited.
Well, Kelly, we're trying to warm you up too for your introduction this morning. So it's great to talk to you on this. But as you're talking to some of these CEOs, like what are the types of things that are on like the tip of their tongue this year?
Oh.
Either.
I definitely think the adoption of AI and how to do that within our organizations is what I'm talking to a lot of my colleagues about, how we can do it ethically, how we maintain our compliance, because our industry is a heavily regulated industry, and which is very important, but it also comes with a lot of challenges and things we need to be mindful of. So we're looking at how can we incorporate this technology across our organizations, from the admissions process to the clinical documentation process through the finance department. I mean, it's penetrated everywhere. And so that's really where the conversations seem to go when I'm talking to
Is that
folks.
same for you, Jamie?
Absolutely, and I just saw you gentlemen in Nashville at the AI conference, and that was on the top of mind. The other thing that I hear from my colleagues as well, and I believe it's adjacent to technology, not necessarily fully AI, but technological realities as well, is patient complexity. And we're seeing, and that's been true for the last several years, seeing an increase in patient complexity and acuity. But the role that technology plays in that as well, with our gambling and screens and porn and bots and all of it, folks ask me about that a lot and what the Meadows is doing.
Makes sense. Both of you all have incredible roles here in the organization, the conference role, and then also leading the organization. What do you think would be what would mean success at the end of this conference if we've done it? What do you think, Jamie?
I'm extremely rooted in the sense of community here. And so I feel if there's alignment and support around the humane, and compassionate implementation of AI, that will be a win.
What do you think, Kelly?
I agree. I think if we can have those conversations, I always leave this conference and I've made at least one additional connection with somebody. So I think having those connections, because it's invaluable to be able to pick up the phone and call somebody. If we're struggling with something at Fellowship Hall, or I have a big decision to make, I've got an entire group of folks that I can pick up the phone and call. If it's around something I know Jamie has expertise in, it's great to be able to have those people available and on speed dial that you can lean into, because it can be a little bit of a lonely position sometimes when you are responsible for an organization. And it doesn't feel that way. And I think when Jamie talks about the community, that resonates with me, because for me, it's not feeling so isolated, so alone in the role, because I'm with others who are also in those type of leadership positions. So that makes this conference feel a little different than some of the others that I attend.
Let's stay with you on this one. I mean, you're surrounded by some of the best leaders in this industry, and I guess what are some of the best doing? What's it look like today versus just average operators in this space? Like, what are the best CEOs that you guys get to collaborate with? What are they doing?
Well, I think Jamie touched on it earlier when she was talking about the acuity of the patient population that we're seeing in this field now. So I think the people who are really what maybe I would term the best right now are those who've embraced that, recognized it, and are putting supports and things in place to address that. 20 years ago, you might treat somebody who was what we like to say kind of a straight up alcoholic. Now it's rare, at least for us, to see folks who are using only one substance. So folks are coming in, they're using multiple substances. How they have started using those substances is often very different than we saw decades ago. I mean, a lot of people start their journey in addiction through maybe something that was legally prescribed to them. So, we're seeing things much differently now, and there's so many co-occurring mental health issues also. And so I think those who are really successful in this space right now have recognized that, and they're adapting at record speed to be able to serve the folks that come to us for care, because that's what it's all about. And that's the other thing that I love being in this particular conference is the heart that people have for the work that we're doing. And it's true for people in this industry, but here it's just so front and center that there's something special about it.
I would agree, and I agree with everything that Kelly said, and I would add innovation to that, because as we have all of these challenges, and I've always been in the co-occurring and even primary mental health space, and it's interesting that now the acuity on all sides has increased, and we have responsibility to keep our patients safe and also to work to find innovative ways to support them and to support our teams. And so when I look at my colleagues, I'm always listening. What are you doing that's innovative from which I can learn?
You know, one of the things when I think about NAATP as an organization, it's always been on the forefront of making sure that people can identify quality treatment versus less than quality treatment. I'm really curious, and I'd love to hear from both of you on this topic. I mean, what do you feel like we're doing right now as an organization to make sure that's happening? So Jamie, let's start with you.
So we have our quality handbook, our ethics and quality handbook, and but we're both on the ethics committee, and we take that guidebook very, very seriously. And everyone is aware that if there's a player out there that falls short of the ethical standards, we want to hear and we want to be a support. And specifically, I can tell you, in terms of digital marketing, there's always some new and clever way for someone to try to game the system, right? And to get people to somehow bid on your name, especially if it's a strong, well-known brand, and to divert patients. And so when that happens, we have the capability, we being NAATP, to work with LegitScript, to work with the FTC, and to really be able to dig into that challenge and to figure out what's going on and how do we stop it. Because people think that they're calling Meadows Behavioral Health and they end up going to some place in Florida that none of us have ever heard of.
How do you feel like we're doing in that battle right now?
We are, it ebbs and flows. But what I can tell you is that NAATP cares. If that's happening to you, let us know, and we will be all over it to support and to fix as best we can.
Kelly, what would you add to that?
Well, I was going to mention the same thing that Jamie said about the ethics committee. As she mentioned, we both serve on that, and we meet monthly to address concerns that members have brought to us about things like Jamie identified, where some of these marketing efforts can be shady at best, and we always take those concerns that people have brought before NAATP to the ethics committee, and we have robust discussions around it. And that's the thing that has really stood out for me with this particular organization is the focus on ethical care and making sure that members of the organization adhere to those ethical standards that we have. And we take it very seriously. There are members within NAATP, and this is something Marvin did when he came in, the CEO of NAATP, and took over a decade ago, was to make sure that people were adhering to that. And that sometimes meant that organizations that maybe could contribute a lot financially to NAATP haven't been participants in the organization because they aren't willing to adhere to the quality handbook that Jamie mentioned and to the ethical code that we have. So it's really important to us that
we had Marvin on the podcast a couple of weeks ago. He was in Nashville, and he spoke. I thought he was very transparent in terms of talking about willing to say no to some organizations, or actually being okay for it's like we're not for everybody. It's like if you're not going to do it the way that we think that it should be done or uphold a certain standards, it's like that's okay. And it's like, and I thought that was really smart, because some trade organizations are willing to maybe look the other way when they
Absolutely.
see large organizations that they'd rather have members, and I think that's important that NAATP stands out in that way.
Absolutely, and that we started talking about the conference, and that even goes down to who exhibits here. And we've said no to exhibitors and sponsors
Do
that
you want to name names, Jamie?
not today. We'll save that till next time, Jeff. But I feel like that's bold because
Absolutely.
NAATP has a business to run.
Right.
And but we always make the right decision, and people aren't happy. No thanks, you can't sponsor. No thanks, you can't exhibit. But there's no gray when it comes to ethics in our field. These are people's lives.
I think that is super. I think that's super important for our listeners to understand is that there are a lot of things that make NAATP stand out from other trade organizations, but that's a big, bold line, and I think it's important.
Jeff, one thing I'm interested in, Jamie, you're the president of the Meadows, and it's a for-profit organization. And Kelly, you're the CEO of Fellowship Hall, a nonprofit. And I would be very interested maybe to hear from both you all on maybe how operationally that works in your organizations. And maybe Kelly, if you just kick us off first.
Well, I have never had the experience of leading an organization that's a for-profit organization, and I know that Jamie and I have had some conversations over my time as part of NAATP, and I find it so interesting. There's so many things that are similar. Obviously the focus on good patient care, focus on ethics, but the behind the scenes operations can be a little bit different. And I've had the pleasure to join our finance committee at NAATP as well, at the invitation of Jamie and some others. And it's always interesting for me to learn from people who have that experience that I don't have, because with a nonprofit, so much of what we do obviously is driven by census, and I think that's true for both organizations, because census drives revenue, and you've got to have revenue to operate. As noble as the work we do is, it does require funds to be able to do it, and there's so much in a nonprofit environment that relies on the fundraising efforts. And so I think that makes it really challenging at times, because we get into situations that we're facing now in our country where economically folks are more challenged, so there's less of a ability to make those type of supportive donations to organizations like Fellowship Hall and other nonprofits. So, we start feeling that pinch, I think, in a little bit different way maybe than other organizations do. But I think what grounds us is that our goals are the same, to see folks get that high quality care. And I'm going to let Jamie speak from the for-profit side of it. I think you've had experience doing both for-profit and nonprofit, haven't you?
I've never worked in nonprofit, and so I worked for a family-owned program, and then publicly traded company and private equity. And so I do believe that there's more similarities than differences, and private equity gets a really bad rep. I did a whole podcast on that several years ago when I was still with Chicago Pacific, and it's interesting because when we have the right people in the right chairs, the goals are the same. And the focus on census and quality-driven care and responsible revenue and responsible operations, that's the same across all of our organizations. And so I've chosen to focus, since I was with Acadia when I first joined the board of NAATP, but let's really focus on the similarities rather than the differences, and let's leave judgment out there, because regardless of the ownership structure for whom I work, I'll always do what's right.
Yeah.
And there's a lot of us out there that work for PE firms that are exactly that way.
Well, and not all PE firms live up to the negative stereotypes, right? It's like, there's some really good ones out there that want to make smart decisions and actually want to make sure that care is at the forefront.
It's really interesting too, and this isn't a comparison between private equity and nonprofit, but I find with private equity too, our reporting is more quarterly. And so we don't have that daily grind of what's your census today? What are you doing today? And that's how Acadia honestly was. And I don't know in your world,
Well,
do you have that?
You mentioned the cadence of reporting, and I'm curious to both of you. It's like, in terms of monthly, quarterly, annually, do you feel like you can do a long-term, think in terms of long-term vision, or do you feel like that, it is sort of a shorter window for measuring results?
So we do, we have a long-term strategy, and then we report to a smaller executive committee on a monthly basis, and then to the board on a quarterly. And it's all on progress on our essential work.
Ours
Kelly?
is very similar. I report to the executive committee on a monthly basis, the full board on a quarterly basis. And as far as the planning that you talked about, the long-term planning, I would say a significant shift that's happened within our organization, I think industry-wide too. It's used to make a strategic plan, a 3 to 5 year plan.
Right.
Now it's a 1 year.
Right, right.
Maybe some organizations are doing 3, but with the speed at which things are changing, I think a year is about all you can do because, there's so much pivoting that happens, typically in a leadership role anyway, but I think it's even more heightened with what the changes that we're experiencing within the industry are. We're pivoting constantly. So, focusing on those quality measurements that we want to track as well as the revenue side of it. But as Jamie said, we want to be sure that we're meeting the needs of the people that are coming to us for care, and those needs are rapidly changing as well.
Yeah, one thing that I know is near and dear to both your hearts too is just I've seen such a rise in women leadership and women rising up through the ranks in this industry and a lot of others. I mentor about 2 companies every year, and for the last 3 years, every one of the CEOs have been women, and very, very strong, competent women. And I know you all lean in heavily on mentorship, and I think Kelly, you're chairing a luncheon on female leadership.
I'm not the chairperson of the
Okay.
luncheon this year, but NAATP several years ago added a women's leadership luncheon. It
Okay.
started as a breakfast, and it was so well attended and so well received. It really supports the women at all levels of leadership in NAATP, and it's a time when we get together and we make those connections, we have those important conversations, and for me it's really become a highlight of the conference. As a female leader, and as you pointed out, there are so many more women leaders now, but that has not always been the case. And so to be able to make those connections with others is invaluable, and I love it. I think it was one of the greatest additions to the conference.
Well, Jamie, I'd be interested. Just my daughter's getting ready to graduate high school. She wants to be a CEO. It could
Okay.
be in a treatment center down the road someday. What advice would you give her, like coming out of school? What types of things should she be looking out for to rise up through those ranks?
Big shoulders and thick skin.
Yeah.
And I've got a daughter that she is 30 now, and the first thing I had her do was go to work at Sierra Tucson as a nursing assistant when she got out of college, and she did overnights and I thought, okay, if you love that, then we'll see if you really want to be in the treatment industry. She's not. She went another path. Not that she didn't love it, but the reason I talk about that, Mark, is that informed her worldview on folks that struggle with behavioral health issues. And she has compassion and empathy and is one hell of a leader, I believe, because of those overnight shifts at Sierra. And so I would get her as much ground floor experience as you can.
Yeah. Well, that's a great answer. And it's great to see you both have risen up through like becoming a clinician all the way up to CEOs in your organizations. And so it just speaks to exactly that.
Yeah, both of you have tremendous clinical experience, which, I love the fact that someone who's either a president or CEO of an organization actually has the clinical background. Maybe you can speak to that in terms of how that informs the way that you make decisions within the organization or your leadership team or things like that. I mean, it's sort of a clinical mindset. So, Jamie, we'll start with you.
Sure. Well, it's always been when I made the decision to switch over from being a chief clinical officer to a CEO, I was inspired to lead a sustainable enterprise with a clinician's heart, because that can be done. Because to me, patient safety and patient care always comes first. And when our team believes that that's who we are, then the leadership part becomes organic, and they believe in us. And we know that when people believe in how we lead, the rest is, I won't say it's easy, but it is, it becomes graceful and it becomes meaningful. And so when I made that decision, I made the commitment to myself to never give up the patient care as top priority. How it serves me today is that I'm able to look at things enterprise-wide and to know when to dive in and be hands-on, and then when to go back out. And so when people know that they can count on you to, I've covered groups, and I'm in CSAT training right now with ITAP and the Carneses, and so I can sit shoulder to shoulder with all the CSATs in our organization and understand that dialogue and understand the training and have that credential myself. So I believe it increases my credibility, and also, again, allows me to be more of service, because that's what I do. Like in COVID, I know we both shared time at Recovery Ways. Like I went to the COVID unit, masked up, suited up, and did groups because, everyone else is going to do it. Why not me?
Right.
If I weren't a clinician, that would be harder. I wouldn't be able to do it.
Well, with a lot of the leaders that I work with that have the clinical background, one thing that I notice that I find remarkable and refreshing, compared to other industries, is this sort of systemic thinking. The idea of like family systems, community systems, and more of a system orientation. And I've seen meetings run in a way that people walk out with just a completely different energy about them. So, Kelly, does that spark anything with you?
Well, it is interesting that you say that, because I started in the family counselor position at Fellowship Hall, and then into the clinical director, and then into the CEO position. And I agree with everything Jamie said, because it's the ability to say, particularly when things are stretched like they were during COVID, I'll step in and do that group, or I'll take a caseload, a small caseload if I need to, I think makes a big difference. It does build your credibility. And I think for me, it really helps when I'm making decisions to understand what the downstream impact's going to be. Because not to fault any leader from whatever background they come from, but it definitely makes a difference when you're making decisions about how we're going to handle documentation or how we're going to incorporate AI right now. We know from the clinician side what that impact is going to be. And it's just a unique perspective that we're able to have because we've done that frontline work. And I think that makes a big difference. And as you said, an organization is its own system.
Right.
And my experience has been that it operates a lot like a family system. So, we have some healthy dynamics. We have dynamics that need a little work, but we're able to look at it from a system standpoint and make the adjustments that need to be made. And I won't speak for Jamie, but I know the conversations that I'm able to have with members of my organization, you can't really take the clinician hat off.
Right.
So I do think that it helps, though. They may say different, but I think it does help when you can approach that conversation from your clinical side as well. You just bring a different energy to it. It's able to look at the big picture, what the organization needs, but then you're also able to really appreciate the individual in front of you and bring those two things together. And I think it leads to a different type of success.
The referrents really love it too. And I find that when I have an angry referent, I don't know if you know this, but referents do get upset with us sometimes.
Really?
Yes.
I've heard about this.
And
I've read thought pieces about it. I've never experienced it.
It really helps with problem solving and repair of a relationship when they know that I understand what's going on.
Right.
Absolutely.
You know, just I think it'd be a waste not to ask you this question for both of you all, and I would love to hear both your opinions. But like looking ahead the next 3 to 5 years in all the circles you're running in, especially with NAATP and all the leaders here, like what are the big things that we're focused on or that we need to be focused on the next 3 to 5 years to really make the biggest impact?
Do you want me to take that first, or you want?
Go ahead.
I would say, obviously, we've talked about technology implication in both artificial intelligence and how it's showing up in our patient populations and their families. And then I would say value-based agreement and payer relations. Are we ever going to move the ball there? And I know you and I have talked about this before, and I feel like in order to continue to be able to deliver the quality of care that Kelly and I are committed to delivering, we've got to have some give on the fee-for-service model, because that's not covering it.
No, and it does seem like there's going to have to be a macro movement in healthcare in general.
Yes.
Before that comes to our industry, but I 100% agree that is where it needs to go. Now, will it go there? I mean, we'll see. We've been talking about it for a decade now.
We have, and I would piggyback with that on mental health parity. You know, that we've got to have movement there as well.
Right.
Because unfortunately, the enforcement's gone.
And accountability.
Yes,
So-
it's gone in the wrong direction.
Yes.
We had a colleague say something in a board meeting, actually, several board meetings ago that stuck with me. He said, we are in an industry where we're providing care to people who don't think they need it, and we're relying on payment from people who don't think they should have to pay for it.
Right.
And so it's a very interesting spot to be in, because we, as Jamie mentioned, we want to be sure we're providing the highest quality care. I mean, it's what any of us would want for ourselves or our loved ones, and we continue to hit that stress point with how is this getting paid for. And, you know, Jamie mentioned the value-based care. It's been talked about for a decade or more, and you know, it doesn't feel like a lot of movement has happened there, and it isn't keeping up pace with what the cost to provide this level of care for folks is.
Put your NAATP hat on for just a moment, and what is the trade organization doing, or do you feel like they can do to facilitate some of those conversations with payers?
Oh, they definitely are facilitating the conversations. We
Yeah.
have payers who are here now. I know the organization has worked really diligently to build relationships with some of our payer sources. I wish it were more of them, but we do have individuals from some of the larger insurance companies who are willing to come and have those conversations with us and dialogue and be part of panels. So there are individuals within the industry who want to do that. It would be great if it were all of them, but that's not where we are at the moment.
Is the right way to do that collectively through like a trade organization, or do you feel like it's better, one program at a time, one company at a time? What do you think, Jamie?
All of it.
All of the
I mean,
above?
I feel like we need to have, and we have had a coordinated effort over the past several years. Nick Jaworski, for a few years, hosted a payer-provider collaborative in Nashville. And it was interesting to see how many payers showed up. And he invited, I think, 20 or 30 CEOs, and we dialogued for a couple of days. And so we're trying every approach. There's a town hall this evening with Optum, Deb Nussbaum, God love her. She shows up for everything.
She does.
And if there could be 15 more Deb Nussbaums, I feel like we'd move the needle. Something that the association is doing too is our Force initiative. And so much of showing up with the payers is to be able to provide your data. And Force has been at the forefront of a collaborative initiative across all the industry to provide that data. And I've used that data with Select Health in Utah, with other payers, and it gets their attention. Now we need their data.
Right, exactly. It does seem like that we bring reams and reams of data, and they just kind of look through and go, oh, I see. And it's like, no, let's see what you see, right?
And a lot of the outcome providers out there, the vendors, I mean, it's really expensive. And so that's the beauty of Force, is that it doesn't cost anything, and you can have this data, because in order to really have a sophisticated, individualized program, it's going to cost you a lot of money, which isn't possible for some folks.
You know, I was fortunate a number of years ago to go to Optum headquarters and sort of see behind the curtain in terms of the information and the data and the analytics that they have. I think that it would be very eye-opening and frankly mind-blowing for a number of people in our industry to see what I saw, because I mean the level of granularity and the information that they have on it is, I mean, that's a whole other conversation.
Yeah.
And it's a matter of
You're
fact, we should
absolutely
probably
right.
follow up on that conversation, because it's remarkable, and it's like people think they don't know. It's like, oh no,
They know.
They
They know.
100% know, and to a level that you wouldn't believe, frankly.
And with Optum as a platinum provider, they provide you with all of
Yes.
that data, and I find it so beneficial.
Yes.
Yes.
Yeah.
Yes.
Well, Jamie, Kelly, we want to be very respectful of your time. We appreciate everything. We appreciate the episode today, and appreciate you taking time out to really help educate our audience on everything that's going on, not just at NAATP, in the industry, and across the whole continuum. So thank you for taking time out, and thank you all for joining us on Mastermind today. On behalf of the entire team, we appreciate you signing in week in and week out. Please join us next week on Mastermind.
That wraps up this episode of Mastermind. Thank you so much for joining us. And remember, Mastermind is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on Mastermind, your behavioral health playbook.